I request Dr. Sriram sir to kindly take the podium.
Thank you. Coming to the final program of this grand event, the most awaited probably among the students and everyone. So the quiz program. So we have myself, Dr. Praveen. So he has been working for almost the last 10 to 15 days in making the questions. Hope he hasn't made it very tough. And Dr. Kalyan, both Dr. Praveen and Kalyan have been working on the questions so that it is so that all the people can enjoy the quiz here. I request Dr. Kalyan to be the scorer, and myself and Dr. Praveen will be handling the quiz. We request Dr. Vijayanand and Dr. Aparna to be the judges. In case any controversy, whatever they say will be the final. No more words after that. So I request Aparna and Dr. Vijayanand to be our judges. Now we had a prelims round, so almost 50 of them participated. Both nurses, lactation consultants and doctors have participated in the prelims, out of which we have chosen 12 people. So among which 6 are nurses and 6 are doctors. So we have already, they have taken a chits and the teams have been randomly allocated as per the chits they have collected. So team A, we request team A, Dr. Mehak and Sister Surabhi. Please come and occupy your chairs. Team B, Dr. Ridhima from Fernandez, Dr. Priyalata, Sister Priyalata. Dr. Ridhima and Sister Priyalata, Team B. Team B. Sister Priyalata is from Jipmer. Yeah, right. Team C, we have Dr. Shivani from Paramita and Sister Kiranmayi from AIMS BB Nagar. Team D, Dr. Akash from Fernandez and Sister Lalita Priya. Team E, Dr. Shravya from Nilofer and Sister Vichitra. Team F, Dr. Ramya and Sister Parul Roja. Over to Dr. Praveen for the quiz rules.
So, good evening all. So there are 6 teams and you have 6 rounds. Among them, one is the visual round and other is the rapid fire round. Remaining 4 rounds are different categories of the breastfeeding. So once one question is asked, you just wait for the time to answer if possible. So the direct question person will get the 10 marks if they answer correctly. Rest of the people has to write the answer in the chits. At the end of the time, so we will collect the slips. That is 20 seconds time. So we will collect the slips and the indirect question people will get the 5 marks. Okay. So this is for all the rounds except visual round and rapid fire round. Okay.
The answer is type 3 lobules. There are 3 types of lobules are described depending upon the age of the mother from puberty to the reproductive age group. So this type 3 lobules are present whenever she is pregnant. Moving on, straight question. So no one, they haven't opened the account. So next question to team B. At what age of embryo does the mammary streak appear? Yeah.
4 weeks.
Right, that's the correct answer. They get full marks, 10 marks. 10 marks to team B. Team C. At how many weeks of pregnancy does the mammary gland starts producing the milk? Your time starts now.
12 to 16 weeks.
Sorry?
12 to 16 weeks.
The answer is 16 weeks. Shall we give? Yes. Okay. They get the marks, full marks. Team D, are you ready? What is the difference between amasia and emastia? Be specific.
Emastia is absence of mammary gland. Amasia is breast tissue is absent.
I am afraid
Nipple
the
including-
answer is, your time is up. Amasia refers to absence of breast tissue. Amastia refers to absence of breast and nipple. Fine, they get full marks. Team E. Which hormone is responsible for alveolar development from alveolar bud and side branching in the mammary gland during pregnancy? Your time starts.
Progesterone.
Good. They get full marks. Team F. Incomplete expression of milk results in low production because of which factor? Your time starts. Time up. It's feedback inhibitor of lactation. Many of the talks that answer was there. So we have come to the end of the round 1. Scores.
So end of round 1, team A and team F are yet to start, and team B, team C, team D and team E each gets 10 points.
Audience question? Yes, anyone? Getting all numbers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's 9 to 12 milk ducts. Round 2, Dr. Praveen.
So round 2 will start from B and it ends with the A. The straight question to the team B. Which cells in the mother's milk are incorporated into neonatal tissues and they offer long-term effect on the growth and disease? Your time starts now.
Time up.
Any guess from other teams? Correct. So this is human milk stem cells, not the breast gland stem cells. There are 2 stem cells are there. The direct question to the team C. Which microbial phylum is most commonly detected in breast milk?
Firmicutes.
Correct. It's firmicutes. So team C gets full marks. So this question is to the team D. Which human milk oligosaccharide has more evidence in reducing the risk of NEC in preterm?
Fucosal lactose.
So it is DSLNT. So it is dicyalolacto N-tetrose, DSLNT. Next question to team E. The pathway that transfers lymphocytes from the mother's gut-associated lymphoid tissue and respiratory lymphoid tissue to her breast milk is called?
Bronchomammary axis.
Time stop. Yeah. Anyone? Correct. It's enterim mammary pathway. So to the team F, which epigenetic material in breast milk is most important for regulating gene expression in infants? Time up. Anyone? MicroRNA. Perfect. So this is the question to team A. What is the typical trend of sodium, chloride and potassium concentrations as breast milk transition from colostrum to the mature milk? So you have to tell complete answer. There are no half or quarter or 1/3 answers. Mike.
sodium and chloride will increase, sodium and chloride will decrease and potassium will increase.
Correct. So, so this is the end of the after the round. So we have scores.
So end of round 2, team C is leading at 20. Round of applause for them. And team B, team D, team E and team A all are equal at 10. Team F is yet to make their mark, but it's okay, we have a super over in the last.
So it's an audience question. What is responsible for the yellow color of colostrum? Yeah.
Yeah, moving on to round 3, starts with team C. Ready? Which indicator is considered the most reliable measure for assessing the transfer of drugs to breast milk in comparison to milk to plasma ratio?
Relative drug dosage less than 10%. Infant dose by the mother's dose.
Be specific.
Relative drug dosage.
Name the indicator.
RAF, R. Relative.
Can you be specific?
Yes, sir. Relative drug dosage.
Okay, time up anyway. The answer is relative infant dose. Should we give? Yeah. Okay, they get, as per the judges, they get the marks. She said relative infant. Yes, so they have answered. So judges have said, so I don't think there is any controversy. They get the marks, 10 marks. Now team D, ready? Which neonatal condition benefits from using the straddle position for breastfeeding?
GER.
Okay. Fine, we can give it. That's fine. They get 10 marks. Team E. What is the nursing position that utilizes the innate reflexes of the neonate the most? Which position utilizes the reflexes the most?
Semi-reclining. Semi-reclining.
I can't hear.
Laid back or semi-reclining position.
Yeah, they get the marks. They get full marks. Laid back position. Team F. What percentage of total intake from breast milk compared to non-human intake is defined as high partial breastfeeding?
80%.
Very good. They get the full marks. 80%. Everyone is stunned the way they are answering. The direct question to team A. For pump-dependent mothers, reaching what volume by the end of second week postpartum predicts the higher odds of breastfeeding success?
So 750 ml per day.
I'm sorry, it is 500 ml. I don't think we can give marks to that. They don't get the marks. Direct question to team B. Which bacteria, commonly found in powdered infant formula and breast pumps, is known to cause serious infections like meningitis and sepsis in infants?
Chronobacter sakis.
Very good. Instant answer. That's correct. Yeah, we come to the end of the third round. Dr.
Yeah, so end of third round, till team C is leading at 30, followed by, yeah, good, clap everybody please. Followed by team B, team D and team E at 20 each, followed by team A and team F at 10 marks.
So What is the effectiveness of lactational amenorrhea method in preventing pregnancy when a mother breastfeeds? Audience, more than? 98. So how frequently she has to nurse to get the maximum effectiveness? Night? Yeah, it's every 4th hour in a day and 6 hours in night. Then the benefit will be more than 98%. So we'll go to the round 4 where we have case scenarios. This round will start with team D. A mother complains of nipple pain during the feed and burning sensation that persists for some time after the baby unlatches. This is how the nipple looks transiently after baby unlatches. What is the diagnosis and what will be the treatment?
Nipple bleb.
Anyone? It looks transiently. Yeah, it's vasospasm. The treatment would be warm compresses after the feed and nifedipine if the symptoms are severe. So now the direct question to team E. Mother complains that her 2 weeks otherwise healthy baby is passing 10 to 12 green frothy stools per day, has mild erythema around the anal opening. She feeds the baby for 5 minutes on each side. What is the diagnosis and how do you manage?
4 milk syndrome.
Yeah.
And you have to empty the breast completely.
Yeah, correct. So team E gets the full marks. So team F, a mother feels sudden sadness or anxiety right before milk let down, which resolves after milk flows. What is the most likely condition?
Dysocial letdown reflex.
Mm-hmm.
Can you spell it?
Dysphoria. Dysphoria letdown reflex ejection syndrome.
Correct. It's called a dysphoric milk ejection reflex. So diet question to team A. An infant presents with pulling of the breast, coughing and fuzziness during feeds. The baby shows excellent weight gain with symptoms starting around 3 weeks of age. Examination of the neonate is unremarkable. What could be the most likely cause? What is its treatment?
So it's a milk letdown reflex. It's excessive milk production in the mother. So she can keep on feeding the baby, and in between she can. There is no need to explain. She should, and she has, every time she has to complete the feeding, sir.
So anything
And
else?
emptying the breast.
Anything else?
Like she can express the breast milk and she can continue feeding. Like little amount she can express so that that overflowing will be controlled.
Yeah. Good. So they get the full marks. So it's called as overactive or forceful letdown or oversupply of the milk. The main treatment for this block feeding each time and avoid excess expressions. The expression should be done only for the pain relief. So and the galactogogues use should be avoided. Team B will get the direct question. A breastfeeding mother presents with nipple pain, blister that is extremely sensitive to the touch. Identify the picture and what treatment would you advise?
This is a plugged duct.
Yeah, what treatment?
Treatment is frequent correct the latch and attachment.
Anyone? Milk bleb, correct. So it's milk bleb. The treatment would be saline soaks, Epsom salt soaks, and latch improvement. Team C. The mother of this baby had nipple pain and difficulty achieving a good latch. What specific positioning advice will you give to improve the latching?
Dancer's hold.
Dancer hold. Dancer hold position.
To improve the latching.
Cross cradle position.
Timer. So the position with exaggerated extension of the neck to help the chin should come in contact with the breast first. while latching. So little bit of more extension will help the good latching for these babies.
Yeah, so end of round 4, it looks like the story of hare and the tortoise. So all are close by. Team C and Team E are leading with 30 each. Team B, Team D, Team F, Team A, all at 20 each. So all of us, let's clap and encourage them.
Yeah, audience. A breastfeeding infant who previously fed well suddenly refuses to nurse despite being hungry. Mother reports no illness, nothing else. What is it called as? Judges can't answer. Nursing strike, that's correct. Yeah. Visual round. Where did we end? Team E. Are you ready? Yeah. This mother is unable to increase her milk supply despite optimal support. Identify the breast pathology. Be specific in answering.
Flat nipples.
Speak into the mic.
Hypo.
Time up.
Flat.
Anyone? Sorry? Tubular breast. Insufficient glandular tissue, also called tuberous breast also. No marks for them. Team F, ready? A 2-week-old baby on exclusive breastfeeding presents with this. What is it?
Suckling blister. Sucking blister.
Good. They get full marks. Team A. What is the name of the positional aid given in this image? Where is it used?
So it's a sling position. It is used in the hypertonic babies.
Yes, correct. They get full marks. Team B. What is the technique which is shown here?
Reverse pressure softening.
You still have time.
Marmot's technique, manual expression.
Sorry, it's wrong answer. I think we have to stop here. Anyone? Very good. So this is for ensuring that the lymph gets drained. So here the massage is being done towards the clavicle where the lymphatics drain. This is useful.
Sir, same.
That is for the nipple.
That is also for engorge.
Reverse pressure is only for the areola level.
This is used in case of mastitis to enhance the edema, to decrease the edema. Sorry.
Sir, this is reverse.
I think this is lymphatic drainage only, sir.
Actually, none of the massage, they help in mastitis first. One should know that whenever now people know that mastitis is not only inflammation, there is leakage of fluid inside the interstitium. So that fluid will not be drained simply by lymphatic sponge because there is vasoconstriction because of edema. But little bit of massage towards the lymphatics might be helping, but it should be away from the areola, not close to it.
Yes, sir. So that's what here it is. The direction is away from the areola towards the clavicle. So what's the final word?
Lymphatic.
Okay. So they don't get the marks. Sorry. The next question goes to team C, right? Yeah. Mother has burning sensation. Identify. Hope you are able to make it out.
Eczema.
Mike.
Eczema. Cracked nipple because of eczema. Sore nipple.
Sorry, that's the wrong answer. It's thrush. Question to team D. Ready? What is this technique?
A Viper's test, that is pinch test. Viper's test, that is pinch test.
Time up. That's a wrong answer. There was a lot of discussion going on. I thought we gave a clue to you. So this is RPS. Yeah. So at the end of the round, Dr. Kalyan.
So at the end of round 5, Team A, Team C, Team E and Team F each are at 30 points each, and Team B and Team D at 20 points each. It's just like we have started the quiz again.
Looks like we need a lot of tiebreakers. Audience who are awake? Yes, it is World Alliance for Breastfeeding. That's their logo. Yeah, it will start with Team A. Yeah, 45 seconds. You have 6 questions. 5 questions. No pass anyway. Yeah, they can. So you have total 45 seconds. You can answer in any way. No issue. Okay. Ready? The time starts now. 45 seconds for you. Where was the first milk bank in the world started?
1909.
Where was the first milk bank started?
Vienna.
Next, what does the term closet nursing refer in context of the breastfeeding?
Pass.
Name the glands responsible for preventing the areola and nipple.
Montgomery glands.
Montgomery gland.
What is the typical pH range of human milk?
So it's 6.9 to 7.4 with average of 7.1.
What percentage of infants?
63.7%.
That's a wonderful answer. You want to go back to? You said pass for the second one.
It's like
Your time is up. Your time is up. So the first World Bank, they said correct. 5 marks for that. Closet nursing, they didn't answer. A situation where the toddler or the old child prefers to nurse only in private due to stigma. The third one is Montgomery glands. Should we give? I think we can. Yeah. It's okay. Human milk pH, she gave a bigger range.
6.9 to 7.
Yeah, she gets it. 64% they get it. Yeah. So they answered 4 questions out of 5. 40. 10 marks for each question. Okay. 5. Huh? 5 marks for each question. Team B, ready? Starts. Your time starts now. How many leukocytes are typically found in 1 ml of colostrum?
Pass.
Rapid defreezing of frozen PDHM leads to degradation of which macronutrient?
Lipids.
Specific. Which bottle feeding method prevents overfeeding, reduces GER, and aids in transition from direct breastfeeding to a bottle?
Pass.
SSRIs, which are safe, what are the safe SSRIs used in breastfeeding mothers with depression?
Sertraline.
According to the World Breastfeeding Trends Initiative.
Bangladesh.
Beautiful. The last question, you want to go back?
First.
Your time up. So the first they said pass, approximately 1 lakh to 1 million leukocytes are there per ml of colostrum. They said lipids, but the question was very specific, so you should have answered triglycerides, so you don't get it. Third one, you didn't answer, paste bottle feeding. Fourth, they get it, sertraline. Fifth, they answered correctly, Bangladesh. 2 answers, 2 correct answers. So 10 marks they get. Please clap. But we have written specific. We wanted which type of lipid there. Should we give? We wanted it. That's why we put the word specific there. Yeah. Yes. Okay, they get it. Fine, sir. Team C, ready? Which bovine whey protein component is hypothesized to cross-react with the pancreatic cells, potentially contributing to the development of type 1 diabetes?
Lactoglobulin.
What pathogens are resistant to Holder pasteurization?
Bacillus cereus.
What is the commonly used assessment tool to evaluate ankyloglossia?
Hazelbacker.
According to NFHS 5, percentage of infants in Telangana are what is the percentage of infants who are
37.
Fifth question, stroking a baby's palm stimulates suckling due to which reflex? Good, time up. They answered 4, I think. The first answer is beta lactoglobulin. The second one they answered correct. It is Bacillus cereus. The tool for it's okay. They get it. The first also they answered. Second one they answered correctly. Bacillus cereus. The tool they have answered correctly. Hazelbacker assessment tool. Fourth one they answered. They said 37. We can accept, no problem. The fifth one they didn't answer. It is palmomental reflex. 4 correct answers.
Ready? Yeah, time starts. So, which two cancers are significantly reduced in mothers who breastfeed their babies?
Breast cancer and ovarian cancer.
What is the term for feeding an infant primarily with non-human milk while occasionally providing direct breastfeeding?
Token breastfeeding.
What is the typical fat loss percentage when human milk is transferred through multiple containers before pasteurization?
Pass.
Sudden resorption of milk products during abrupt weaning causes fever in the mother. What is it?
Pass.
What is the global breastfeeding collective target for breastfeeding rates by 2030?
70%.
Yeah.
30%.
So it's breast cancer and ovarian cancer, token breastfeeding, and 30 to 50% of the fat loss. Milk fever is the condition for the mother having fever with abrupt weaning, and 70%. They answered 3 questions correctly.
30% also we said. 30%.
But you answered the third question. You answered as last at end. You told.
After the bell rang. The bell along with the bell rang. Do you have a third umpire? Along with the bell, he told.
Along.
Because the bell was interfering with the.
40. It's 4 questions. 4 correct.
Team E, ready?
Yeah.
Time starts.
Where was the first Asian milk bank established? Country and city.
India, Sion, Maharashtra.
What is the term used to describe the state of deep relaxation or drowsiness a baby experiences after a feeding session?
Milk coma.
State with highest breastfeeding rates in India. NFH 5.
Mizoram. Meghalaya.
What is the commonly used screening tool to diagnose postpartum depression? Which immune components largely remain unchanged in donor human milk after pasteurization?
DHA.
Time up. So they get the marks for the first 2. Second question, milk coma, they answered correctly, and rest all they did not answer. So they get the 2 correct answers. Ready? So, Team F, what is the gold standard metric used to measure the effectiveness of breast pump for milk removal?
How many stages? 9 stages.
How many stages? 9 stages. Expand IBFAN.
International Baby Food. Baby Food Action Network. Whey casein ratio in colostrum is 70:30. Shelf life of raw milk in freezer.
Maximum 12 months.
Raw milk in freezer. 24 hours.
Freezer maximum 12 months.
Time up.
They asked the questions and they answered.
The gold standard metric is percentage of available milk removed. So it's labor intensive, but this is the gold standard method to assess the efficacy of the pump. There are 9 stages, they answered correct. International Baby Food Action Network, they answered correct. It's in the colostrum, it is 90:10. So raw milk can be stored for 3 months, not the pasteurized. I asked about the raw milk. So they get the 2 correct answers.
So that's the end of the quiz.
Big round of applause for the quiz masters. It was like a neat question. So end of the final round, rapid fire round. Our scores are, I want everybody to clap after each score. So team B is at 35 points. Big clap for them, please. Followed by team D, team E and team F, all 3 at 40 points. So finally team A and team C at 50 points. So this is not the end of the quiz again. We hand over to the quiz masters for the tiebreaker round.
So team A and team C, ready? So we'll be asking 3 questions. So you have to write it on the answers in your paper. We'll not reveal the answers. So at the end of the 3, then only we'll take the papers. Okay?
Timer, sir.
Right, ready, both of you? Elaborate CHINS, acronym for the principles of attaining good attachment. A breastfeeding mother presents with a gradually developing palpable lump in her breast. The lump is associated with localized pain, which decreases in size with milk removal. There is no fever, no erythema. Most likely diagnosis and treatment. Time starts. Time up. You can collect. Last question. What is the typical range of maximum suction pressure for a hospital grade breast pump? Time starts. If you have written, you can hand over the chits. Time up. Okay, we reveal the answers. The kind says close to body, head free to tilt, in line, nose to nipple, sustainable. So that was wrong, both didn't answer. The second question was block duct, improving latch position the baby such that the chin orients at the quadrant where the block duct is there. So both don't get this also. And the last one, what do you think? It is 250 to 300. So, one team has written a near value. 200. 200. The other team is far off. Even if you have written half, it nullifies. Judge's decision is final. So judges have said that. So it is the team C that gave the correct answer. So team C represented by Dr. Shivani from Paramita Hospital and Sister Kiranmai. Sister is from AIMS BB Nagar. The second prize goes to Dr. Mehak from Paramita Hospital and Sister Surabhi from AIMS BB Nagar.
Thank you, and thank you everybody. I think again round of applause for Sriram, Praveen, Kalyan. I think they have done a lot of background work. You can see how much they have read. I'm sure they must have been the largest beneficiaries of conducting a quiz. So thank you for conducting this, and thank you Vijayanand and Aparna for taking the difficult decisions and also helping in getting to the correct team. So thank you, and thank you Kushwa sir for the suggestions. So I request Arun Singh sir, Kushwa sir, Keshavlu sir, Aparna, Vijayanand, organizing secretaries both Nitasha and Swapna to come onto the stage. All the quiz masters and Kalyan also please join, because we need to felicitate all the people who have, I think the quiz people also should be appreciated. Big round of applause for the teams for participation first and then for winning. So I think participation is the biggest success, and then 50 to I think 60, 70 people waiting until the end is also big achievement. Big round of applause for all of you. So please announce the teams, and then we'll give the certificates. Sir. Ravi Shankar sir. Welfare. Okay. C. Suresh sir. Kashinath ji. Sir, Arun Kumar sir. Arun Singh sir. This is the first prize for both of them. Sarkiya. C. Suresh sir. Certificates. Sir, medals. Mire sir. Aparna, please. The runner-up, Mehak and
Surabhi.
Surabhi. Please come on us. Thank you. Thank you. Kushwa sir, Keshavlu sir, Kashinath ji. Aparna, please join. So, each one, no? Sir, Kushwa sir and Keshavlu sir. These are real silver medals. Yeah, please sir. Keshavlu sir. Sir, Kashinath ji, please put your hand for giving the prizes.